A significant proportion of Gaza's population is now facing catastrophic hunger and famine-like conditions. Despite reports of increased delivery of food, there is currently no evidence that those who need it most are receiving sufficient quantity and quality of food. Over 8,000 children under 5 years old have been diagnosed and treated for acute malnutrition, including 1,600 children with severe acute malnutrition. However, due to insecurity and lack of access, only 2 stabilization centers for severely malnourished patients can operate. Our inability to provide health services safely, combined with the lack of clean water and sanitation, significantly increased the risks of malnourished children. There have already been 32 deaths attributed to malnutrition, including 28 among children under 5 years old. While the world's focus has been on Gaza, there is also an escalating health crisis in the West Bank, where attacks on healthcare and restrictions on movement of people are obstructing access to health services. Since the war in Gaza started, 508 Palestinians have been killed in the West Bank, including East Jerusalem, including 124 children. Sudan is the world's largest humanitarian crisis, with 12 million people displaced, 10 million internally, while 2 million have fled to neighboring countries. More than 70% of hospitals in conflict-affected states and 45% of health facilities in another 5 states are not working. And the remaining ones are overwhelmed with people seeking care. People are dying from a lack of access to essential services and medicines, while there is a very real risk of mass starvation in some regions. Critical services, including maternal and child health care, the management of severe acute malnutrition, and the treatment of patients with chronic conditions have been discontinued in many areas.